Welcome to the Business for Good podcast, a show where we spotlight companies making money by making the world a better place. I'm your host, Paul Shapiro, and if you share a passion for using commerce to solve many of the world's most pressing problems, then this is the show for you. Hello, friends, and welcome to the 90th episode of the Business for Good podcast. First, let me give a shout out to Andrew from the Bay Area, who I recently met at an event at Mission Barns. It's a cool startup that is cultivating fat without animals. And he recently told me that he read one of the books that I had recommended on the show, Tender is the Flesh, which is a novel that I absolutely loved, and I do highly recommend it. So, Andrew, thanks for listening to Business for Good, and I'm really glad that you enjoyed reading Tender is the Flesh. Now, some of you may recall that in episode 88, we discussed family planning work going on in Nigeria. Well, in episode 61, we also met Your Choice Therapeutics, which is pioneering new ways for both men and women to take control of their reproductive destinies. But as I said in episode 88, we would soon be talking more about family planning right here in the United States. And so here we are. So what about current options for contraception in places like the good old US of A? Well, I had mentioned in Your Choice Therapeutics that for men today seeking to avoid impregnating women, there really are only two options, condoms and vasectomy. Of course, a lot of people, men and women alike, just don't like using condoms. So the question becomes, who is going to be responsible for preventing pregnancy, the man or the woman? And in the US and most of the world, that answer falls unequivocally on the woman. In fact, the ratio of tubal ligations to vasectomies is nearly 10 to 1, globally speaking, despite the fact that a tubal ligation is a much more invasive procedure that requires general anesthesia, whereas a vasectomy takes mere minutes and it can be done in an office as opposed to a hospital, and there are even scalpel-free methods that are now available. So our guest on this episode, Dr. Esgar Guarin, is on a crusade to promote vasectomies, and he even gave up his previous medical career to focus on simply being a full-time vasectomist as part of his commitment to making the world a better place. That's right. His entire business is one thing and one thing only: helping men take greater responsibility in their reproductive lives and averting unwanted pregnancies. But it wasn't enough for Dr. Guarin to have a doctor's office in Des Moines, Iowa, specializing in vasectomies. This guy has now gone out and built the country's first ever mobile vasectomy clinic where people can come knock on the truck's door and get a vasectomy on demand. The message emblazoned on the side of his vasectomy mobile says, "One small snip for man, one giant leap for human kindness." While this is his livelihood, Dr. Guarin also travels throughout Latin America performing vasectomies for free and promoting World Vasectomy Day, the movement. And get this dude one Friday night even decided to vasectomize himself. Yes, you heard that right. He auto-sterilized. Now that is hardcore. Dr. Guarin's message is very clear. Vasectomies are so simple, so fast, and so easy that even he could do it just himself at home alone. In this episode, Dr. Guarin dispels myths about vasectomies that will be reassuring to men on the fence. Yes, you'll still keep your balls. Yes, you'll still produce the same amount of testosterone. Yes, you'll still ejaculate the same amount of semen. And yes, you'll still have the same blood flow when you need it the most. What you won't have is the possibility of creating an unwanted pregnancy. I am super impressed by the way that Dr. Guarin has turned his conventional medical career into an evangelical movement to spread the good word about the benefits of vasectomies. As he points out, the number of reasons to get a vasectomy are vast. Maybe you've had kids and don't want any more. Maybe you've decided you'd rather adopt a kid who needs a family rather than bring another human into an overpopulated world. Maybe you don't want to raise any kids at all. Either way, Dr. Guarin has a message welcoming you to come join his movement. So enjoy this episode hearing from the face of the international movement to popularize vasectomies. I now bring you Dr. Esgar Guarin. Dr. Esgar Guarin, welcome to the Business for Good podcast.
Well, thank you very much, Paul, for having me here. Very excited to share some time with you.
I am excited about this because this is a topic that is near to my heart, and I guess it's also near to another part of my body that we'll be talking about because you are a full-time vasectomist. I didn't even know that such a thing existed, but that's not what you've always been doing. So I know that you've had quite a storied career. So let's just talk briefly. What were you doing before you were just snipping men's vas deferens?
Well, I have to tell you, Paul, that full-time vasectomists, there are some around.
Okay.
vasectomies are a procedure that, are part of the arsenal of procedures that many surgeons have or many physicians have.
I don't know if you want to use the word arsenal when you're talking about vasectomies, man. Like, yeah, it's not a weapon,
Well, no, it's not, but it's part of the repertoire, I would
Okay,
say
great,
better.
great. Thank you.
The
Yes.
repertoire of procedures that many physicians have. In fact, in the rest of the world, the vast majority of vasectomies are performed by general physicians and family doctors. There are places where actually these procedures are performed by gynecologists. These procedures are mostly into the repertoire of the urologists because they focus on that area of the body.
So wait a
But
minute,
anyway,
there are some people who get a vasectomy from a gynecologist?
correct. For
Wow.
example, in Ethiopia and in Guatemala, 75% of the vasectomies are performed by gynecologists. And if you think a little deeper into that, it makes total sense because
Is there a shortage of urologists or no?
no, it's been more the opportunity to perform those procedures has been there more for the gynecologists because of the proximity that they have to the family when they are going through the process of pregnancy. So when you think about the interventions that women have gone through or they go through in terms of reproduction and contraception in general, the gynecologist is not in actually in a bad position to offer a procedure that is definitely less invasive and offers greater benefit for the woman, obviously because she doesn't have to get it, but in general because the procedure is so simple that he's probably a good person to offer that procedure. So it really shouldn't reside in in one particular specialty. Now, some of us have decided to go into just doing this procedure for specific reasons, and we can chat about
Yeah.
those reasons that I have had later.
What type of a doctor were you prior to being a full-time vasectomist here?
So I did my medical training back in Colombia, where I'm from. I went through medical school there, and then after I finished medical school and fulfill a requirement in my country that is expected from every single person who graduates from medical school, which is going to a rural setting in the middle of nowhere and work for the government for a year so that we can get our license. I came to the States following my wife. She's a microbiologist and she's Colombian as well. She went to the University of Maryland to do some training in immunology and ended up staying there. So what was supposed to be a short period here back in 2002, 2003 ended up being the rest of our lives in the United States. And at that point, I decided to start doing all what is required for me to be able to do my specialty training in the United States. Initially, during medical school, I was very interested in psychiatry. Human behavior has always been extremely interesting to me. My first love, I'd say, was anthropology. I really wanted to get into anthropology, but in Colombia, I guess I was very short-sighted and didn't think about the possibilities of what I could do with anthropology. And the next best thing for me was medicine, which is basically an anthropological study of diseases. So during medical school, I was so interested in psychiatry. But that year that I spent in Colombia in the middle of the mountains, far away from a big city, working for the government, changed my view of what I could do with medicine. And I had to take care of pregnancies. I had to take care of elderly patients. I had to take care of injuries. And it was a very, very interesting and amazing experience. So when I came here and I was thinking about what I wanted to do in terms of a specialty training, I learned about this thing called family medicine, which was not a thing in Colombia. In Colombia, the role of a family physician is done by GPs, which are people like me back then who graduated from medical school and start working. Yes, we are ill prepared for many things because a family physician has more preparation for us to be able to tackle a little more complex diseases. But it was very interesting. So I chose to do that, and I was very interested in focusing my work on maternal and child health. There's no such thing as pediatrics and obstetrics combined. So the best thing to combine that was family medicine. So I went with that. And And then after I finished that, I wanted to continue to have more training in the obstetric part of what I was doing. So I went ahead and did a 2 additional year fellowship at Brown University in Rhode Island in maternal and child health. And I was always interested on reproductive health because of what I was doing. Obviously, if I was interested in pregnancy, I, by default, was interested in reproduction. And what was very interesting to me in terms of reproduction was just the provision of services that were not as invasive and that were simple enough that you could provide with a huge public health impact and reproductive health impact. So I was very interested on the provision of vasectomies for that very same reason. But being in the East Coast was a little, let's say, malignant for me to try to get that kind of training in vasectomies, because there was always this thing of, oh, you must be, and that happens in this country, you must be a urologist to be able to do that. Well, no, I need to know the anatomy and I need to acquire the proper skills to do the procedure adequately. So during residency, I tried to get that training and it didn't happen.
Doctor, let me just ask you, so why vasectomies? Like, I understand that you were interested in reproductive health, but there's a lot of people who have particular interests. My uncle, for example, became really interested in foot and ankles, and that became like his thing. He's a foot and ankle surgeon. He's now retired, but that was like his thing, just foot and ankles. You thought, I want to sterilize men. Why? Why was that the thing that you wanted to do?
Well, that's the thing. So it initially it was having that as part of what I was doing. I was able to do, eventually after my fellowship in maternal and child health, I was able to do tubal ligations. I was placing IUDs. I was placing implants. And it was nice to have that because it was a very simple procedure with a huge impact, as I said earlier. But after I was full on practicing on my own, and I was delivering, 90 to 100 babies a year, and I got to see the difficulties that women go through, that urge to do more vasectomies, to include men more into that contraceptive equation, it became a very important part of what I was doing. So seeing the difficulties that women go through by just taking simple oral contraceptives, by using an IUD, by having to deal with an implant, by having to deal with a pregnancy and giving birth. And yet we are there as men only having fun making the babies and not participating anymore, was kind of upsetting. It was kind of frustrating to me. And I was, again, I was interested on the idea of doing these vasectomies for quite some time. I have to tell you this, and I had mentioned this before elsewhere. The very first time I heard the word vasectomy, I was probably about 10 years old, 11 years old, and my mother demanded that from my dad. And when I saw the expression on my dad's face and the way he reacted about that demand, because she was pretty open about that demand, I realized at that tender age that word was having a huge weight and a real big impact on men and in general. And I wanted to know that. So I understood obviously what it was when I was in medical school. And later on, I realized that it would have a tremendous impact on trying to balance that relationship between men and women in terms of contraceptive decisions and reproductive health in general. So I guess I had, since a very early age, this curiosity about what the vasectomy was. And eventually, I realized the huge impact and the applicability that a vasectomy had. And having that experience with women, seeing what they went through was extremely, extremely important for me to make that decision of moving on to just doing it. But it was difficult for me to leave everything that I was doing before, right? Because I was doing a lot of maternal and child health, and then I dropped everything just to do vasectomies.
Right. I mean, you could almost say it was a whole new ball game for you. Sorry, I could not resist. All right. So Yes, thank you. So you want to get into this whole new ball game of just doing vasectomies, but I just want to chat for a second about this disparity between men and women and the issue of who is responsible for contraception. Because we've done a past episode on this on male contraceptives. Basically, there's condoms and there's vasectomy. There's not a lot else out there for men, whereas women have a multitude of options, many of which you just named, but all of them are pretty have substantial potential side effects. It's not that they're bad. It's not that you shouldn't do them, but taking the pill is does have some effects. And so the question is, how can men be more involved in prevention of unintended pregnancies? And I think for a long time, a lot of people have thought of a vasectomy, like your father, as this invasive surgery, something that might come from an arsenal of weapons that is going to have all types of deleterious effects. It's going to be painful. It's going to cause all these problems for you. But you are maybe the country's leading evangelical for vasectomies. And so just do us a favor here, Doc, and just dispel some of these myths. So you're doing vasectomies that don't even have a scalpel. You don't even use a scalpel. It takes mere minutes to do. So tell us, what are you doing? And why would somebody who doesn't want kids not want to do it?
Well, let me answer that in two parts. The first part is you were talking about the disparity that exists, and I think that needs to be highlighted because it is true that we only have two contraceptive methods that are currently effective that we as men can use, and it's condoms and vasectomies. The disparity that I'm talking about is not just about the fact that we only have two methods, is the fact that I focus specifically on the issue that when the time comes for a permanent decision, men are not stepping up to the plate as much as women do. And then let me put it in perspective. When we look at the numbers, according to United Nations during 2019, the number of vasectomies that were performed around the world based on survey data was approximately 16 to 17 million in the entire world. By comparison, that's nothing when you see the number of tubal ligations. We're talking about 219 million tubal ligations during the same year.
Wow. So almost a 10-to-1 ratio.
That is correct. What that's telling you is that the participation of men when it comes to a permanent decision is not even a tenth of what the women are doing. We are not advocating necessarily for more men to be sterilized just for the sake of sterilization, right? Let's just for a moment, let's set aside that, yes, it is too many of us on the face of the earth with 7.8 billion people. Let's just assume that that's not an issue, but it is. But let's assume that
that's a big assumption, but okay, for the sake of this next few minutes, we'll assume that.
Yeah. No, but just for just 20 seconds, we're going to assume that that's not an issue. If we look at the fact that there are approximately 235 million sterilizations, right, in general, including vasectomies and tubal ligations, we are not advocating, I personally am not advocating for increasing the number of sterilizations overall, right? We need to think about how many of us are on the face of the earth. That's fine. But I'm not advocating necessarily for just more sterilizations. What I'm advocating for is more male sterilizations when the decision is made for no more children at the expense of reducing the number of tubal ligations. So we could say that instead of having 230, give or take, million sterilizations per year with only 16 million vasectomies, we can have, 150 million vasectomies and 150 million tubal ligations. It's just balancing that equation a little bit more for men to show that we can actually be part of that contraceptive definitive decision when the time comes to making it. The modern methods of contraception have been wonderful, and they have been the reason in many places for a decrease in the use of certain methods of permanent contraception. In Nepal, for example, which back in the 70s, contraception with a vasectomy was extremely popular, it went down. The use of vasectomies went down considerably once the modern methods of contraception were introduced. And we're talking about an intrauterine device, the implants, the pills, the injections. because they started using them more. And then there was no need for that. But when you look specifically just at the numbers of sterilizations, it turns out sterilizations in women have not decreased. You could argue that women have been using more, have been taking more ownership on the control of their fertility by using these methods of modern contraception. But what it seems to me is that men, little by little, have been getting out of the whole discussion. Is it the medical establishment telling us, "Oh, that's not your thing to do. It has to be the woman," or is it us using that as an excuse not to be part of it? I don't know.
Isn't there a big difference, though, in that ratio between vasectomy and tubal ligation between the United States and Canada?
It is. In fact, in the United States, the ratio is about 1 to 2 to 3. That is one vasectomy. When there's a vasectomy done, there are about 2 to 3 tubal ligations done in the United States. In Canada and in other countries like the UK and Australia, the relationship could be actually the opposite. In Canada, for example, for every tubal ligation, there are 2 vasectomies done. And if you go a little bit more specific, in for example, in Quebec City in Canada, the ratio is about 1 tubal ligation per every 5 vasectomies or so.
Fascinating. So if you're looking at this as UK, Canada, Australia, I mean, Canada and Australia never rebelled against the UK and had a revolution, whereas the US did. We went on our own path. And part of that path, I guess, was favoring tubals as opposed to vasectomies. But let's get in here, doctor, to chatting about what this is, because, a lot of people, they hear vasectomy and they think you're going to cut their balls off. So they say, "Oh, isn't that what we do to dogs and cats? When we spay and neuter them, when we neuter them, that's a vasectomy." But that's not a vasectomy, right? So what is it, and briefly, and how do you do it that is different from what's been done in the past?
The 20-second explanation of a vasectomy is this: the testicle produces sperm and produces testosterone. The production of testosterone, which is the male hormone, goes through a different channel going through the blood vessels. The production of sperm goes out of the testicle through a tiny little tube called a vas deferens. And it ends up communicating with the urethra, which is that tiny pipe that brings everything out, the urine and the semen out. So the vasectomy is nothing but cutting that tube and disrupting the communication between the testicle and everything else.
So it's not going to interrupt testosterone production. And the volume of semen that is still coming out is the same. It's just not having sperm in the semen.
Correct. So virtually the same, because you have to remember, Paul, that 95% of what comes out in an ejaculation, 95% of that liquid that comes out, comes from the prostate and the seminal vesicles, which basically are there to nourish and support the sperm that is coming from the testicles. Only 5% of that semen in the ejaculation is coming from the testicles. So virtually there is no difference in the amount. And you have to remember that every ejaculation is about 2.5 to 5 cc's overall in general. So it's nothing that you see of a difference.
So just to be clear, you're not cutting the balls off. No. The testosterone is the same. The ejaculate is essentially the same. You won't have any hormonal differences. The only thing is that your semen will not have sperm, so you cannot impregnate somebody.
Well, now, you're talking something else. And forgive me for interrupting you, but I think this is extremely important because in the collective mind of men, deep in the back of the collective mind of men, there's this hidden fear. It doesn't matter how much we read about vasectomies and how much we learn about them, that things might not work the same. So I need to highlight the fact that erections are not going to be affected either. So no problems with testosterone. The only way for me to affect the testosterone is ripping out the testicle out of your scrotal sac, and that's not going to happen. And there's no way that there's going to be an effect on erections, because we don't affect the blood vessels feeding the penis when it gets erected. So there's no effect on that either.
Okay, got it. Now, in the past, you had to cut the scrotum open to get to the vas deferens, and that's what they were doing. But you don't even do that. Tell us, what are you doing, and what is becoming more and more commonplace for vasectomies now?
Well, this is the sad part of that, Paul, because this technique of no scalpel technique is a technique that was invented in the late 70s by Dr. Li Shiguan, who was a urologist back in China. he came up with this brilliant idea of sharpening a forceps, which is kind of like a clamp that was blunt, and sharpening it enough that you
Man,
can.
we need a better word than clamp here, because no man wants a clamp on their scrotum. All right, but
Well,
what's better?
I'm trying to think of an instrument.
Yeah.
The name
Yeah.
because that
It's
was
like a massage.
actually.
It's like a massage. Let's just say it's like a massage.
And this is imagine is like, well, I can't think of any word better, because if I use the word pliers, it's probably not going to make anybody relaxed. But
Yeah, that sounds fun.
this instrument actually, it is very sharp and pointy. So by doing that, you actually penetrate the skin like a needle. Imagine how a needle gets into your body. You put a needle in your arm, and then when you take it out, the skin kind of closes on its own. You might drip a tiny little drop of blood, but the skin actually closes. And that's because when you're entering the skin with the needle, the trauma that happens onto the skin is very minimal, right? It's a kind of a progressive trauma. Whereas when you use a scalpel, you have to disrupt the skin. You have to cut it. And a classical approach for a vasectomy, you actually make two incisions, one in each side, because we have to vas deferens, and then you perform the procedure, and then you have to close that, because when you break the skin like that, when you cut the skin, you have to put it together, which means you have to thread a needle through the skin and put a stitch. Doing that increases more trauma. So Dr. Li Shiquan thought, well, what if we just penetrate the skin as if it were a needle, right? And then spread the skin. By spreading the skin, you don't break anything. You just spread the fibers of the skin and use that opening, one single opening, to get each one of the vas deferens there and perform the vasectomy, and then send it back in. It is so tiny, the incision, we're talking about 10 millimeters, less than 10 millimeters, which is less than half an inch, that if you hold pressure 30 to 60 seconds afterwards, you don't even need to put any skin glue or sutures to close the wound. So the trauma is less. And we know that for a fact, because many have looked at the evidence. And for example, one of the dreaded complications of a vasectomy is the collection of blood in the scrotum. It's called a hematoma. If you do a classical intervention with a scalpel and put in sutures, the chances, even in the hands of an experienced surgeon, could be up to 3% of having that. When you do a non-scalpel technique, the chances go below 1%, which is great.
So it's a pretty minuscule percentage, no matter what. You have a 97 to 99% chance of no hematoma.
Absolutely.
But how long does it take for you to do this? So if some guy comes up to you and says, hey, Dr. Guarin, I don't want any more kids, or I don't want any kids, how long is it going to take you from the time he walks in to the time you're done?
Well, the actual procedure takes 10 minutes. That's
okay.
10 minutes. But I personally spend about 30 minutes with the patient. Because I like to, when you are given the privilege of grabbing the scrotum of someone with sharp instruments, you ought to take that, with all the seriousness you can, and you have to take your time to talk the patient through the whole process. You have to remember, Paul, that this is all I'm doing now. So all these patients come to see me once and once only. I really don't want them to come back. Because if they come back, that means there's a problem, or if they come back, that means that it didn't work. So I need to make sure that it is, I guess, I don't know if I can use this word, but that the whole experience is unforgettable in a good way. So I give him 30 minutes, even though I could do the whole thing faster. I give him 30 minutes. I stay there, talk with them, and then I prep him and do the procedure in 10 minutes. And then the rest of the time is just chatting. But that's all it takes.
Right. All right. So 10 minutes. You don't even have to inject any type of pain relief, right? It's just like a topical spray. Isn't that right?
No, it's not a topical spray. Actually, what we do, we use a pressure spray device applicator. I use that. I mean, you can use a needle as well for the administration of the anesthetic. And in fact, a very good friend of mine, Dr. Michel Lebrecq from Quebec in Canada, uses what he calls the mini needle technique, which is a super thin needle, about a 30 gauge needle, which is thin as those used for insulin administration, that is almost imperceptible for the patient when you use the needle. and provide the anesthetic. What I use is a pressure spray device applicator that pushes the anesthetic at a very high pressure, close to 1200 psi. You can imagine how hard that is, through a very narrow stream of fluid. And it's so thin and so much pressure that it pierces the skin down to a depth of about 6 millimeters, and the vas deferens is right under the skin. So it hits the vas deferens and it numbs the vas deferens right away. So
I see. So you're not injecting a needle; you're basically just forcing the liquid in there. Okay. Okay, got it. So let me ask you then, like, how did you decide to go from being a doctor who's just performing vasectomies to becoming an evangelical? Because you've created the country's first ever mobile vasectomy clinic where you're driving around just encouraging people on a whim to come up and get a vasectomy. So what happened? Like, how did you go from being a doctor who does vasectomies to being the face of the vasectomy movement?
Well, one of the criticisms that I had regarding the performance of vasectomies was doing vasectomies kind of like on the side as part of what you were doing as a doctor. And in taking care of pregnancies are very demanding. It's not that a pregnant patient will wait for me. It's like, I need you now, and I don't care what you're doing. Come, because my baby's going to deliver. So I was, on the go all the time with these patients, but I really wanted to provide this service. And it was the experiences that I was having with my pregnant patients, seeing the difficulties. And there was a particular time over the course of 2 years that I delivered five different women pregnant by the same guy. That really got me thinking about all this. It was so bizarre that I don't think anybody could have written this whole experience of the 2 years with these 5 women. Initially they all hated each other because, you took him away from me. Oh, he's with me now. And I had to hear that because I'm the kind of guy who talks a lot with the patients. So I knew all this stuff that was happening. And eventually they all became friends because they all hated this individual because he left them. And I had the opportunity to engage with this gentleman at a certain point for a minuscule thing like a sore throat or something. So I actually had developed a relationship with him. So I approached him. I took advantage of that relationship and approached him. And I said, look, I couldn't have been any more blunt with this person. And I said, you need to consider your options. Let me give you a vasectomy. And opposite to what I thought was going to happen, because I really thought he was going to say something like, oh, man, don't do that. It's not my thing. He was very nice, but he said no. And I inquired a couple of times about why, and he wouldn't answer. And obviously I understood I could not push that. It's not my place to do that. But I felt that it was one of my biggest failures. I saw that was not fair for the women. That was not even fair for the guy. Not that he was paying child support anyways, but it got me thinking about what the barriers were that were limiting men from making a decision that, when rationally you think about it, seems like a no-brainer, right? It's 10 minutes, I go to the doctor, 10 minutes, I get it under local anesthesia, it really doesn't hurt. It's better than for a woman to go and get a tubal ligation. But men still don't do it. So I started thinking about the barriers. And there's a really good book called The Human Element by Lauren Norgren from, I think it's Northwestern University in the administration, the business administration department, that talks about frictions. And I started thinking about the frictions that men face when they have to make decisions or they want to make decisions in terms of contraception. And particularly with vasectomy, I realized that there were frictions. I know those of my species. I know those of my gender. And I know that for something so intimate, you don't want to talk to a receptionist. You want to talk to the person who can give you the answers. You don't want to go to a doctor and get, an evaluation for 5-10 minutes and then being told that you have to come back in a month for the procedure. And probably a month later, when the procedure will be done, they tell you, oh, the doctor has to cancel because he has a more important surgery to do, which is fine. But then it delays everything. When a man says, I'm going to get a vasectomy, he wants to get it done, period. It's not that a man wakes up one morning and says, I think I want to get snipped, and then he gets it done. No, he's been thinking about it. And then, so you want to reduce any barriers. So thinking about those barriers, I came up with this idea of making a whole model that was going to make things as simple as possible for the individual to make that decision. So that at the end of the day, there is no excuse for someone to not get a vasectomy. And if the patient doesn't want to have the vasectomy, which is totally fine, it's just because he doesn't want to get it done, not because there are barriers, not because it is too expensive, not because I have to talk to 2-3 people before I talk to the doctor, not because I have to wait 2 months to get the vasectomy done, not because I have to, bring a sample within 45 minutes to an office after I've gotten the vasectomy. All those barriers need to be taken away. And also, it was important for me to provide adequate evidence-based information and bring, so to speak, out of the closet the whole discussion of vasectomies. I think that women, because of what they have to go through with visits to the gynecologist often and allowing somebody to a certain extent violate their intimate space by letting them use a speculum and placing instruments down in the genital area, they are more open to have discussions about this. And the example is this, Paul. If you have a woman who gets an IUD and probably she has a good experience with one of these IUDs with progesterone that gives them very little bleeding, they will talk about it. They get together and then they are with their friends and they say, oh my gosh, I got my IUD and I am so happy I haven't had a bleed for 3 months. And they talk about that openly. And then the conversation goes on to other things. Men don't do that. We don't talk about it. And the reason is because of that deep fear that we have about that vulnerability that we feel we are going to have if we let anybody know about it, because they're going to think that things are not working the same for me. And to me, those barriers and those fears needed to be addressed. So I changed the way the vasectomy, at least in the clinic that I ended up developing, the way the patient could access the procedure. So I made it as simple as possible, and it's a smooth process. And I said, I need to talk more about this. I need to bring it out of the closet, as I said earlier. We need to normalize the discussion of vasectomies. And from the experience that we had in Mexico and Indonesia, from what you see in the literature in Nepal, where using mobile units increases the uptake of reproductive services, I said, we have better roads. Clearly, they need some work, but they're better roads than in any of those countries I just mentioned. Why don't we use a mobile unit? Why don't we use a mobile unit to go around just raising eyebrows every time they see the mobile unit and actually doing the procedure in the mobile unit to convey the message of the simplicity of the procedure? So we basically, I built from the ground up. Finally, my wife bought into that because I had been toying around with the idea since we went to Mexico with World Vasectomy Day for 3 years. And she bought into that and she said, all right, let's just do it, because she knew it was going to be a waste of money in the sense that it was not going to, the return of investment was going to be terrible. But it was part of that activism. It was part of what was driving me, to talk about more about this. So we built it. You'd be surprised, Paul, there is no regulation about how to build one of these things in the country.
You're getting out in front of the regulators, I think, here. I don't think they've foreseen what you would be building.
I was going to say something. I mean, because I'm not doing anything out of the ordinary in there. If I'm going to do X-rays, there's clear regulation on that. If I'm doing dental procedures and I need a dental equipment, I need there are regulations specific for that. But basically, one of the reasons why there's no regulation on that is because it's an office. It's an office on wheels. Basically, that's what it is. Because a vasectomy should be done in an office setting. So we designed it. I found this company that was willing to work with me, and we put it together. It has a room with a sink. It has a waiting area, which is not used as a waiting area because I don't have people waiting in there. They just come in, get the procedure, and they leave. And there's a restroom in there. And I drive around.
Is it still one patient per 30 minutes, or is it faster than that?
No, it's one patient per 30 minutes, because to me is the experience of the patient.
And so you mentioned that the ROI is poor. So somebody comes in, they say, okay, I'm ready to get snipped. What do I owe? What are they going to pay you?
We charge, I normally charge in the office $699.
Okay, $699.
Per
And
visit.
so
But
is
in the mobile unit, we charge $100 less, which may sound counterintuitive, right? Because it's like, hold on a second, you're going to the people, you're just taking the service to their place. Why are you charging less? Because you have to show that it's, in part it's a joint venture with World Vasectomy Day. Although I say joint venture, but they put a lot of emotional capital, financial capital. But it's a way to show that this is accessible, not only because I'm bringing it to you, but also because it's even cheaper. It's $100 cheaper.
Right. So are you making money per vasectomy, or are you offering the service for less than what it costs you?
No, I do. I do make money.
Okay. So it's still, so there still is some profit margin, thankfully for you, that it's not, you're not conducting a charity here.
No, not necessarily. I mean, I have to pay the bills, and
yes.
I have to pay the bills. I just, even if it were a nonprofit, sometimes I think that people have the wrong idea about nonprofits. They think that, nonprofits are not designed to make money, right? Nonprofits are designed to make money, not to to the investors, not to give it back to a board of people who own the company, but just to invest it again into the nonprofit. Well, in my case, I have to pay the bills, and 5% of every single vasectomy we do, whether it's paid by insurance or it's paid by it's paid out of pocket, 5% of that goes to World Vasectomy Day, which is a nonprofit that I work with, that I travel with around the world, teaching how to do vasectomies and doing vasectomies for free.
So just to be clear, for people who haven't heard of World Vasectomy Day, it began as a one day out of the year, but now it's really a year-round movement, right? It's in November, but it's really World Vasectomy Day is really just vasectomy awareness throughout the year, right?
Correct. So this is our 10th year doing this. Okay. It all started with Jonathan Stack. Jonathan Stack is an accomplished filmmaker, documentarist, and he started as many stories with filmmakers trying to document his own vasectomy. And he met the person who's been my mentor, the person I learned vasectomies from, was Dr. Douglas Stein, vasectomist in Tampa, Florida, who was part of another organization called Non-Scalpel Vasectomy International. And he just saw what he was doing and stuck with him for a year or two, and realized that vasectomies have a huge impact, not only from the reproductive standpoint, but socially as well. And Jonathan was doing a bunch of documentaries on bad things, as he describes it, bad things that men do. He would be in war zones, jails all over the world. He has done several documentaries in Angola prison and Louisiana, and it was always showing what happens when men do bad things. And when he started traveling with Doug Stein, he began to ask every single man who was getting a vasectomy a simple question: why? Why are you doing this? And he saw that behind every single one of these guys, there was a manifestation, an expression of love towards somebody or towards something when they were making that decision. Oh, I'm doing it because, my wife has had enough. We've had 7 children and she's had complications with the pregnancies. Well, it's an expression of love towards his wife. Oh, I'm doing it because I have 5 children already, and this is all I can support, or I can barely support them. Well, it's an expression of love towards his family because he wants to be able to allocate his resources in a better way. Or you have this gentleman who comes in and has no children whatsoever, and he says, you know what, I think it's too many of us on the face of the earth. I just don't want to have children of my own, and if I change my mind, I would adopt a child. Well, that's an expression of love towards himself and towards the environment. So it was like a huge eye-opener for him, and then he started documenting all these experiences with people, and they came up with the idea of doing a major event in Adelaide, Australia, 10 years ago, which was the very, very first World Vasectomy Day. And they televised vasectomies, real time, showing the procedures. People obviously were given their consent, and he thought it was a good idea to get the domain, and the domain was worldvasectomyday.org, and it became a second event, a third event, and now we're going to celebrate our 10th anniversary this year.
Amazing. So let me ask you first, do you have any children of your own?
I do. I have two children. Yeah. I have a 15-year-old who has been a wonderful adolescent so far, and I have an 11-year-old who thinks he's 20.
Okay. And are you vasectomized?
I did have my vasectomy. In fact, I did my own vasectomy. I think about 6 years ago, I did.
I know. No, you performed your own vasectomy.
Yes. And I cannot take pride on saying that I'm the only one who's done it. I know of a good number of people who've done it. And I did it.
I mean, but you hear about like how doctors aren't supposed to perform on immediate family members of theirs because there could be like emotionally attached that could lead to some bad outcome. Doing your own vasectomy, tell me why.
Well, I wanted to put myself through that. I had this thing that every time I was seeing a patient, I was performing a vasectomy on. Some of them would say, "Hey doc, have you had your vasectomy?" And I'd be like, "No, not yet." And there was this I guess disappointment on behalf of the patient, and it's like, oh, okay, you haven't gotten it. So it's like, you're doing this to me. You're telling me you do a ton of these, and you don't know what this is.
Yeah, you're like, do as I say, not as I do. You're like, do.
And I had that experience delivering babies with women, because it is very difficult to show your true empathy to a woman who's trying to push a human being out of her body. When you're a guy, when you're a man in front of her, and you're saying, "Come on, you can do this. I know you can do it," because they look at you like you're a total idiot, and they're right? And the only way for me to show that I really understood what they were going through would be to acknowledge that, and I would tell the woman, "I know what you're thinking, that I'm a total idiot, and you're right. I don't know what this is. I will never be in this situation, and I'm so happy I don't have to go through this, because it really takes a woman to deliver a child. But I've seen many of you doing this, and I know you're designed to do this, and you can do it." And then it would just make them understand that I really was meaning what I was telling them. But when it comes to a vasectomy, actually, I happen to have the same equipment, than the gentleman who's there in my exam table. Why wouldn't I just put myself through that too? Besides, to me, it was, I don't know, it seemed like a testament to the simplicity of the procedure. I'm not advocating for people who do vasectomies to do their own by any means, and I'm not absolutely anybody can get it yourself. Do it at home.
You're not going to have a do not try this at home.
That's right. That should be a disclosure here. Do not try to do this at home. But I don't know. It seems like it was a way to show the simplicity of that. It's like what I do with the mobile clinics. Like I can show with the mobile clinic that the mobility of the vasectomy is so great that you can even do it on a unit that goes from place to place. So I did it. It sounds so lame when I tell the story, because at the end of the day, it was a Friday night. I finished my clinic, and I called my wife and I said, "Honey, I want to get my vasectomy done. I'm going to do it tonight." And it sounds super.
And so this was after this was after 4 drinks, I presume.
No, not at all. I was totally sober. It may sound like I was not, but it's super sad, because people would think, well, this poor guy, he's so sad that he doesn't have anything better to do on a Friday night other than sterilizing himself. So, and I did it. My wife was there actually, because I called her and I said, "Look, I need you here in case I need to do something." I set up 2 trays with double the number of instruments in case I drop one. And it was just, it took me like 5 more minutes, but it was actually surreal when I think about that. But the point here is not necessarily the fact that I did my vasectomy. Some people,
I think that is the point, actually. I'm intrigued by the story.
Some people don't like me telling the story of that, but I think I insist on telling it, just because I think it conveys that message of simplicity of the procedure. The point at the end is that, the procedure is that simple, compared to the alternative, which would be a tubal ligation. I'm not here saying my gynecology colleagues are butchering women. No, they know what they're doing. Absolutely. That, a tubal ligation is kind of like a bread and butter type of procedure for a surgeon, a gynecological surgeon. But we cannot underestimate the risks of general anesthesia. The fact that a woman has gone through so much already, and the fact that the alternative is way faster, way safer, and way cheaper than tubal ligation is.
So let me ask you this, Doc. You're running around in this mobile clinic. You're driving around. Anybody who wants to come up who has like $500 or so can get vasectomized by you. Do you ever turn anybody away? Like if a 19-year-old comes up to you and says, I want to get vasectomized and I don't have any kids, or, is there anybody who you just say, hey, listen, come back at some other time?
Age is not necessarily an issue for me to turn someone away. Age itself is demands from me spending more time with this individual before. So if somebody knocks on the door of the mobile unit and says, I want to get my vasectomy done, and we're talking about a 19-year-old, I probably wouldn't do the vasectomy right on the spot. I probably would have a long conversation with that person. Not because my interest is to make them change their mind. I think that in reproduction, we have to be very careful with that, because we ought to respect the decision that somebody makes in terms of their fertility. But I have a responsibility, which is putting things in perspective for that individual, right? A 19-year-old, we feel as the surgeon a huge responsibility. But this feeling that responsibility doesn't mean I put on top of that responsibility my personal bias. I have to respect what the individual wants to do, but I want to make sure that I have adequate feedback on the potential of regret in the future. So I probably not do that right away.
Yeah, I mean, what if a 19-year-old goes to a tattoo artist and says, I want to get some, big tattoo on my back? Like, are they going to turn them away? I don't think so.
I agree. I 100% agree with you. What I mean with what I said is that usually, because I've had 23-year-old, 24 years old people, men with no children who come to my office. But the process is a little different because they have signed up online. They have come. I have had a conversation with them over the phone, where I actually put things in perspective, and then they come for their procedure, right? But if they knock on the door right away and they want me to do it on the spot, and if I have the conversation with them at the time and the feedback is adequate, and you'd be surprised about the deep conversations I have had with some of these very young men about their fertility, and I get convinced right away, I probably would do it. My gut reflex initially is like, probably I would ask him to look at the consent and all that, because they have to sign that consent. And then, he can come back and get it done. Not because I want him to think more about his decision, but I want him to see the prospect of what comes forward. One of those conversations that were super deep happened precisely in Mexico. During World Vasectomy Day, I had a gentleman who came, a 23-year-old, finished his university. He was a graphic designer, single child, no children. The Mexican authorities had set up had this setup that included a social worker, a GP, and then the surgeon. So the person, and these were people coming off the street. They went through that process, and he comes to me. So I looked at all the information. He has no children. I said, all right, well, you understand that this is a permanent decision. Moving forward, there's an increased risk of regret. I'm not saying that you will regret it, but I'm saying that statistically, there's a higher chance that you could regret it. You might not. And he's like, yeah, I understand that. And I said, well, all right, we'll do it, because it seems like you've talked to a lot of people, and I have to respect that. I think it's a matter of pure respect for your decision. But let me just remind you that a vasectomy is a permanent decision. And this guy,
is that true?
Let me finish this, Paul, because this is the key part of that. He grabs my arm, looks at me in the eye, and he said, I understand that, Doc, but it turns out having children is also a permanent decision. And it cannot be deeper than that. He's absolutely right. you could have children and you could be an awful parent. You may not pay child support. You never see your child. You're not a role model for your child. But it doesn't make the child disappear. The child is going to be there. So why do we, question so much making the decision of when somebody wants to make the decision of not having children? But we don't question that decision that many make of having children and turn into awful parents. And what you said is absolutely true too. You have a 17-year-old go to an Army recruitment office, and they don't tell him, hey, are you sure you want to join the Army? No, they say, well, sure, sign here. And that's a very consequential decision in the life of someone, at a tender age, even before they are adults. And some people, say, well, a 19-year-old should, I'd never do a vasectomy in somebody like that, or 25-year-old. I had a guy who was 35 and had been trying to get a vasectomy for 8 years and didn't give him the vasectomy because he was too young and didn't have any children. That's disrespectful. Anyways.
Yeah, it's pretty outrageous. It's very paternalistic to deny what an adult wants to do, even if you think that it's a bad idea. This is why I say, like, a tattoo artist generally probably won't turn down a young person who wants to get a tattoo, despite the fact that that too is a permanent decision. But I want to ask you, doctor, because you've said a couple of times this is a permanent decision. I actually saw not that long ago a billboard where I was driving, and it said vasectomy reversals, and it said, call this number. And I thought, that is amazing that somebody makes such a living out of vasectomy reversals. Like, how many people even have vasectomies, then let alone regret it and want a reversal that this billboard could have like a good return on their investment for them. But obviously somebody's doing vasectomy reversal. Yeah. So how permanent of a decision is this?
Well, when you do a vasectomy, you have to assume that it's a permanent decision. Yes, the reversals are possible. And there are microsurgical techniques that make it to an extent easier, in the hands of an experienced surgeon. But it has to be assumed as permanent, because when we're talking about the effectiveness or the success of a reversal, you have to look at two different numbers. Because we're talking about success of sperm being back into the semen, but that does not translate into the success of having a pregnancy, right? You can do a reversal and you can claim an 85% success rate of having sperm into the semen again, but does it translate into an 85% chance of having a pregnancy? It usually does not. So people need to understand that it's a big gamble, because reversals could be upwards of, the lowest range could be probably $5,000 if you can get that. But in many places, for example, in California, I don't think you will find anything less than $10,000 cash. Same thing happens on the other coast. So it's a very expensive procedure with a considerable margin of failure. So you have to make that decision of getting a vasectomy, knowing that, you have alternatives. If somebody says, well, what if I change my mind, but I'm really set on making that decision now, an alternative could be just sperm storage, right? You can freeze sperm and keep it and pay for the storage of the sperm for years, and you get your vasectomy. You can discard that later if you just definitely realize that you never change your mind.
Yeah. Right. You could also just adopt kids. I
agree with you.
And, there's a lot of people on the planet, and there's a lot of kids who need homes. So it's not that bad of an idea, maybe, just to raise a kid who has no family.
Right.
So it's not that bad of a thing.
That is what I hear from many of these patients. But as I said earlier, my job is to put all those things in perspective and say, hey, these are the alternatives. I'm not going to tell you what to do, but these are the things that you should look at as a possibility in the case of a future regret. I would hate for a patient like that to 10 years down the road, if for some reason he changes his mind, I would hate for that person to say, you know what, I went to this doctor and he didn't even ask me questions. He just did my vasectomy, right? I would love for him to say, you know what, I went to this doctor. He said this is what could happen in the future if I change my mind. And we had that conversation, and he was very respectful of my decision, and I went ahead and did it. Now I changed my mind. Yeah. But in retrospect, I love the fact that he put things in perspective for me and respected my decision, right?
How many vasectomies have you now done, Doc?
Let's see. I was doing when I was busy with my obstetric practice. I was doing about, and I was delivering about 100 babies a year. I was doing about 250 per year, which by the standards that I would love to live by was not enough. I've been doing about 400 a year now.
Wow.
But if you hang out with the people I hang out with, we're talking about people who, on an average, do 1,000 a year.
Wow,
about
amazing.
Michelle Lebrecq does
Amazing.
about 1,500 a year. Doug Stein does about 2,500 a year. But they live in different places, right? Doug Stein lives in Florida, 22 million people in Florida. I live in Iowa, 3.3 million people, right? It's a different mindset.
Yeah. You need to be doing more of these mobile clinics in Latin America. That'll be the way that you get your numbers up, I guess.
Well, we actually go to Latin America. I've been in Colombia. We've been in Bolivia, Ecuador.
Oh, I know. Yeah, you mentioned Mexico, which is why I was alluding to this. You said that you said you're doing them for free.
Mexicans are fantastic doing vasectomy. The problem is in Mexico that they're doing too many tubal ligations. The relationship still, it's about 1 to 10. So the 1 vasectomy per 10 tubal ligations. And they're doing a lot of vasectomies. Perhaps one of the best vasectomy programs you can find anywhere is the Mexican vasectomy program, because vasectomies in Mexico are free. The government pays for them. And even they're done by GPs, and they go through a very, very disciplined and strict program of 6 months for them to be able to do them. And they do them better than the urologists. And
just to be clear, it's 6 months on top of medical school. It's not just like a 6-month program.
No, 6 months after they become physicians.
Yeah, right. Yeah, I just want to make it clear. You said this rigorous 6-month medical training is after they're already doctors. Yes, right.
GPs, general physicians are doing that.
Got it.
They have a really very well-established program, but I think the issue is that still the mentality is let's dump this responsibility on women. Actually, we continue to work alongside the Mexican authorities. We have a good relationship with World Vasectomy Day with them. And it's all about increasing the awareness. There's a lot of really good people in Mexico trying to push for more vasectomies at the expense of reduction in the tubal ligations. But it's a cultural issue. It's a cultural issue. And it's more of a cultural issue in some places more than in other places. But in general, there's a big cultural issue that leads this.
Yeah. Well, very cool. Very cool. So you've created a whole business here, Dr. Guarin, on helping men to get vasectomized. It's quite a impressive way that you are using the force of commerce and your own career to help make the world a better place. You mentioned earlier a book called The Human Element as something that was influential on you. We can link to that in the show notes at businessforgoodpodcast.com. But are there any other resources that you feel have been helpful for you that you think other people might appreciate or might benefit from you dropping right now?
Well, you are very familiar with this person because he wrote the foreword of your book, Yuval Harari. One thing that, and it probably made me think a lot about what we're doing in the world, and it was his book *Sapiens*. It was a terrific thing for me. It took me a while to read it because I would read a portion of the book and it would shake me so much that I had to put it down because I had to think about everything that was happening around me, around the world, how I viewed the world. And then I have to wait and pick it up again and then start reading. And I put it down again because it's a very interesting book. And it made me think about, I guess, making decisions to really feel as satisfied with the social projection that I was having. And I felt like I was satisfied because I was helping families, young families, and the pregnancies and all that. But I felt like I was lacking that social projection. Every time I came back from overseas doing vasectomies, I would come back incredibly energized. It was excellent. And then I was just slow down, because I was just in the same routine of doing the same thing I was doing already with every single case of pregnancy, which I absolutely loved. I don't get me wrong. It was hard for me to leave all that and just do only vasectomies. But being able to do only this freed a ton of time for me to be able to focus on World Vasectomy Day, to focus on the projection, on the discussion, on the activism of what I was doing already. So I guess that book was really helpful for me on that. It shook me personally. And this other book on, I listened to Shankar Vedanta and Hidden Brain talk about fuel and combustion. Fuel and friction. It was a podcast he had, and then I started reading more about this, and I came across the Lauren Nordgren's book, The Human Element, and it talks about friction. And I had been thinking about the obstacles of men having a vasectomy, and it has put a lot of things in perspective for me. I think that not just to not with the purpose of marketing something, but with the purpose of understanding why people don't do certain things. That book is fantastic, and I like it.
Very cool. Well, we will link all of that in the show notes for this episode, again, at businessforgoodpodcast.com. Let me ask you then, finally, a final question here that we ask everybody who comes on the show. Obviously, you are devoting your life to vasectomizing as many men as you can, and that is an extremely noble thing. But I'm sure there are... I'm sorry?
As many men who want to do it.
Yeah, you're not yet into the involuntary sterilization game. Okay, I'm with you. So the question I'd have for you though is: are there other business ideas out there that you hope that maybe somebody listening to this show will pursue themselves? It could be in contraception or anything else. I mean, there's you mentioned that only condoms and vasectomies are the options for men. Maybe there's some business out there to do something else that would help men make an easier time. Maybe with something that's more reversible than vasectomy. But what else is there that you hope that somebody else might take up, let's say, take the ball and run with it and create a new business here that will do some good in the world?
Well, with additional methods of contraception, there's a lot in the works right now. There are multiple things that have been tried. So I'm just hopeful for those things for men to flourish. But businesses, I think that one of the biggest problems that we have, at least in this country and many other countries, but at least in this country, is our healthcare system. And I think the healthcare system has been awfully, awfully complex. It has become too complex. And my own experience doing what I'm doing, the way I'm doing it, simplifying the access to vasectomies is something that I would love to see in other aspects of medicine. The simplification of the patient-physician relationship. Taking out of that relationship so many third parties that complicate the process. There has been a movement that has been out for a while already called direct primary care, and that movement of direct primary care has helped a lot of people to have primary care services at a very affordable cost, and has allowed physicians to get out of that rat race that many feel we were in when you're seeing patients, when you're demanded by the relationship you have with insurances. To see patients every 10 minutes, and you don't get to know the patients very well. I think that businesses that look at simplifying the relationship, simplifying the delivery of healthcare, would be businesses that I would love to see flourish more.
All right. Very cool. Well, maybe there will be a future episode of this podcast where someone who is inspired by you to start some cool new business doing just that will be the guest. So one can hope. But Dr. Esgar Guarin, thank you so much for all you're doing. Really appreciate all the work that you're doing to help men take more control of their own reproductive lives and do some good in the world here for a whole variety of reasons that we've mentioned. So I appreciate what you're doing. I hope that we get to meet in person sometime. And I really hope that I get to see this mobile clinic. As you say, one small snip for man and one giant leap for human kindness.
Very good. Thank you very much for having me here, Paul. It's been a total pleasure. And thank you for spreading the word.
Thanks for listening. We hope you found use in this episode. If so, don't keep it to yourself. Please leave us a 5-star rating on iTunes or wherever you get your podcast. And as always, we hope you will be in the business of doing good.